Does spotting in early pregnancy mean you're going to have a miscarriage? This can be a really scary thing to experience, and there's a lot to unpack here, so let's get into it. Up to 25% of women experience spotting in early pregnancy. And there's a lot of different reasons somebody may start having spotting. The first few weeks of pregnancy, there's a lot of growing and stretching and changing of your uterus and of your cervix, and this can cause spotting. Spotting also can take place when there's minor tissue injury or trauma to the vagina or the cervix. That would include intercourse, speculum exams, cervical checks, pap smears, things like that. Infections can cause spotting, something called a subchorionic hematoma, and all of these things can be perfectly normal. What begins to concern me as a nurse is if the spotting is getting heavier and worsening, clots, if the mother is now experiencing painful cramping and that's becoming worse along with the spotting. And that's when I start to become more concerned that this could be a situation of early pregnancy loss. So if you do notice spotting or cramping or both, you need to talk to your provider. And after you speak to your provider about this, the next steps as to what they will do to help figure out if this is normal or if this is concerning, that varies from one provider to the next and one patient to the next. Your provider may want to draw lab work, they may want to bring you in for an early ultrasound, or they may just have you stay home and give it some time. Put a pad on, drink your water, put your feet up and rest while you guys are talking and deciding what the right thing is to do from that point forward. I personally have experienced this in my pregnancies and it's very scary, so I feel for you. And for more information about pregnancy, birth, labor, give me a follow and check out my page.